Hi, everyone. We're back talking about how to harness large language models in healthcare informatics. So today we're going to be talking a bit more about bias and data management for large language models. This slide is just to help you start thinking through what do we have to do to be able to leverage large language models effectively in our practice if we want to go in and start fine tuning them, for example. You'll remember fine tuning means that we are going and we're changing all of the math in the background of the system so that it more accurately represents the types of data, the types of responses that we are expecting and wanting from the system. So step one is we have to go do data collection. Step two is we have to start distinguishing between what's structured, unstructured, what's trustworthy, what's less trustworthy, and we have to go do data cleaning. So getting all of our sources together, compiling into a large bucket, and then finding which sources that we most want to leverage and use. And then we go use that to fine tune. We might also do some things, you'll remember in the previous lecture how one of the reasons why ChatGPT works is we train it on question response. And so if there are specific things that we're expecting out from the system, we might go massage some of the data so that it is outputting in more of a format that we're wanting, hoping for by leveraging that training data to help us generate more training data. That's called synthetic data. Part of our healthcare mission is we're dealing with patients. And so when we're dealing with patients, we have to be a lot more sensitive about how we're handling the PHI and the sensitive data that we're dealing with and who has access to these large language models. Never use PHI in an environment where you don't assume that that PHI has the potential of leaking. In many cases, if you go back and look at some of the early articles of ChatGPT or any of the major models, they would leak people's phone numbers, they would leak people's information, and the more famous you were, the more likely you were going to have information online that people were using to be able to find that and use it. So when you're going to use this data, if you are using it on an LLM that is for your general health system, you want to apply de-identification techniques for the training data. If you're using it for an LLM that is specifically used for clinical purposes, that's not necessarily what you're going to want to do. That's going to be a discussion that you're going to need to go into over, do we want this LLM to potentially serve up patient-specific information, or do we want to try and make it more de-identified? In general, my guess is most organizations should go with de-identification first. And the prompt and the data that we pass it into the LLM should contain all of this patient-specific information. As often as possible, we're going to be looking at LLMs who are aggregating and anonymizing data. So LLMs, with predicting the very next word, tend to the mean, tend to be generic. And so keep that in mind. If you have a very small patient representation in something that is very important to you, say you're a heart hospital and you treat a specific disease state in one clinic, you might want to go overtrain on some of that data so that they are better represented in what the LLM can provide you. And we've talked about the re-identification risk. Oops. I'm not going to dig into it. Most of you here are going to already have some idea, but just so that you're thinking about it, we do need to keep in mind that there are regulatory frameworks that are evolving and that we do have to respect, even if we're using AI and large language models in ways that haven't been used in the past. And just remember your HIPAA boards, GDPR, IRBs, and don't just assume because there is no human involved you can skip all of these steps. So I want to talk to you about bias in healthcare data. And we have a lot of different types of bias that we can tackle here. We've got algorithmic bias. We've got the training data itself is just non-diverse. So if you're in a health system where 95% of your population is white Caucasian, you're going to have a lack of diversity in your training data. And you're going to want to consider is that how is that going to impact what's going on? We can do measurements on the level of skewed that our data is. And when we are going to implement these tools and make these steps, we need to measure that. We need to know exactly how uh, the data is skewed and what level of skewedness we're dealing with. We also have historical issues. So there's going to be misrepresentation in records or underrepresentation in research studies. Because large language models are predicting the next word and regressing to the mean, um, if you give a large language model 80% examples where people are being misrepresented or underrepresented, the large language model is just going to keep perpetuating that same thing. And so that's part of why we need to look at the skewedness and deal with it. And then in terms of diagnostic impacts, so actual clinical care, we can address this with good prompt engineering, which is what we're talking about in this course. But in general, if you just go in and ask it to make a diagnosis, it's going to make the most generic diagnosis from the data that's provided. Sometimes that can be useful, sometimes not. So if you are looking for a super rare disease, it is unlikely to identify that super rare disease without good prompt engineering. If you are looking for your bread and butter disease states, it is going to much more frequently address those and show those online. One of the benefits is with these large language models, they somewhat overrepresent uh, uh, disease states that are much more rare. Because if people can find communities, they tend to post about it online, then it became available. And so if it's available online, it's in the training data, it's much more likely to show up. So there are thousands of methods for detecting bias. Uh, the ones to keep in mind is we need to do statistical checks. We need to understand the distribution. We need to know the sensitivity and the specificity. We have to involve people who have seen a little bit along the way. So if I'm going to be trying to detect bias, I need a clinician, I need an LLM expert, and I would ideally have some people from underrepresented groups that we are specifically interested in making sure that are represented all in the room looking at how is it outputting, what is it outputting, why is it outputting, is this actually representing us? So out of amusement, and I write fiction books, and I was writing a fiction book that is the historic, generic young boy blacksmith becomes sword wielder, savior of the world, dragons, excitement. And I went in to one of our favorite platforms and I told it, hey, I just want a blacksmith. Um, I told it with magic, without magic. I told it a lot of different things. But the thing that it always gave me was it gave me a young white Caucasian boy until I started specifically prompting racially ambiguous. Even then, it tended to get romance vibe. And why does it get romance vibe? Because that's what we've trained it on. Most, you'll see a lot of blacksmiths represented in the romance arena. So, what we have to keep these things in mind. No matter how innocuous, innoc- no matter what is happening, we want to understand and know what is the system going to be generating us in general and in specific. And if you can only create young, attractive blacksmiths um, that are white, that is a systematic problem that should be addressed. we don't all need to look like romance characters on the book cover. And it might sell the book cover a little bit better, but these are the types of bias that are found in large language models. They're just not quite as obvious in most instances. So there are a lot of mitigation strategies. I mentioned that we can use synthetic data to help build out additional underrepresented groups. We can also just cut down some of the data that we're using. For the overrepresented groups, we can balance the data or oversample the underrepresented groups. We can also do some post-processing to remove the biased language. And as we're doing all of this, we do need to implement some type of continual monitoring and feedback loops. There should be something that is looking at the text that is being generated and doing some scoring and allowing you to evaluate at an aggregate level, how is it working, why is it working. And so in the classroom, we're going to be talking through uh, examples over what people have seen or what people are thinking, just finding some examples of where we might have ethical dilemmas and how we might address them specifically. Thanks so much.